Hello, I'm Dr. Dennis McKenna, as always, joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center. Today is Thursday, July 9th. Okay, we'll begin with some COVID and then we'll go to non-COVID topics. Let's pop up the first graph here. This is COVID-19 cases in the 8 counties of the Capital Region that are currently hospitalized. Continues to look great, Fred.
Yeah, it really does, doesn't it, Dennis?
So 28 currently, so that continues to be a low number. Let's pop up the second graph. Now this is admissions and discharges to the Albany Medical Center with COVID. Fred, what you can see now is that we now go about every other day.
That's right.
With an admission. In fact, over the last 7 days, we've only had 5 admissions to the hospital. Back in the height of this, we were sometimes admitting 5 a day or more.
As many as 10.
10.
Yes.
Yeah. So that continues to be a great story. And now the last graph, which is the morning census here at Albany Medical Center. These are people who are diagnosed with COVID-19 in hospital at Albany Med. And Fred, we're under 10.
We're under 10.
Yeah.
It's tremendous. And we heard the numbers yesterday for the region, and those numbers are down about a dozen inpatients as well.
That's right. So that's 8 on the floor and 1 in the ICU and none on a ventilator today.
That's right.
Let's take another minute, just do a deeper dive into some numbers. I'm going to have to read these. We haven't talked about these in a while, but from the very beginning of the COVID-19 pandemic, we've been doing a lot of testing on this campus.
Yes.
We had the outpatient testing location in the tent.
That's right.
People remember the tent. Test in the emergency department, drive-through, and of course in the hospital. So Fred, we've tested 9,954 people for COVID. And of those, 494 have been positive. So that's about 5%.
Right.
We've had 355 unique admissions into the hospital. And I think it's fun to break them down 2 different ways for what it's worth. So of those 355 admissions, 197 came to Albany Medical Center directly. 45 came from New York City.
That's right.
And we have 113 that are also transfers from the region that came in, not from New York City. So about half sort of presented natively and the other half came in as a transfer in. Now let's break it down another way. Of those 355, 196 are 60 or older, 151 are between 18 and 60, and 8 are less than 18. And we've only had 2 admissions in that category in the last 3 months, so that's great news as well.
Tremendous.
Now, Fred, I think you wanted to talk a little bit about how we keep doing as well as we're doing.
Well, Dennis, I think the numbers are terrific, and particularly when you put them in context of what we've seen over the past 3 or 4 months. It's important that we not drop our guard. It's really important. So how did we get to where we are? Social distancing, good hand hygiene, and masks.
Okay.
And so it's really critically important, particularly in the hospital, that everyone, visitors, staff, physicians, nurses, technicians, everyone, really adhere to the rules around appropriate mask wearing.
And it's okay to remind your colleague if they don't have one on, to
carry an extra one and say, hey, do you need a mask?
That's right. Very good. So good message, Fred, and we'll continue to remind people about that. Fred, what is FastPass when it comes to Albany Medical Center? FastPass.
So Dennis, we have visitors come in between 4 and 8 p.m. to visit their loved ones that are admitted here in the hospital. And we have to ask them a series of questions before we can let them in. So that really created a huge backup when there are 300 people trying to get in at the same time. So our IT folks created a FastPass. So it's off of our website. They can go in, answer the questions. It pops up green or red. If it's green, they get a FastPass. And so when they get here, we know that they don't have any of the symptoms that we're worried about or travel. And then we take their temperature and let them in.
That sounds like sort of like they do at the airport sometimes.
That's
as a way of clearing that quickly.
Right.
So who on our team built that? Our IT folks?
So Bill Duax's group. Just a tremendous shout out to them. They put that together literally in a few days.
Yeah. We have an incredible IT team, so that's really wonderful. And the goal, of course, is if they get in quicker, they can spend more time with their family member.
That's right.
Which is great.
Absolutely important.
Let's talk about a couple topics which we'll sort of put together that are not COVID related. The first one is, Fred, we got a letter here a couple weeks ago from someone, I'll use his first name only, it's James. So he tells a story about his mother, who he says at a very young age actually was orphaned. And she grew up in what was then known as the Holy Names Academy, which is now our center building.
That's right,
on Madison Avenue.
Madison.
Yeah. So he took her for a ride, and she was looking at the building, and she noticed the flagpole there. And she said that as a young girl, she has memories, 75 years ago, of raising the flag each day outside the school. Her comment to her son James was, the flagpole has seen better days.
Yes.
It had seen better days, and it had. So pick up the story from there, Fred. What happened?
So, our facilities folks heard about this, Emilio Genzano and Eric Melanese, and they replaced the flagpole.
They did.
Yeah.
They did.
So we're going to actually take a picture of that flagpole and send it to her so she can see what it used to look like, hopefully.
Yeah. And in addition to that, a flag, the first flag that we put up in the new flagpole, is going to be sent to her. So a nice surprise for her. But, thank you to the son for sharing that memory with us.
Yeah, and thank you to the facilities folks for fixing the flagpole.
Yeah. Well, I'm a big fan of the flag, so I think that's wonderful. So thank you very much to them. Fred, I think we want to also talk about an issue that's important that came up. You were on a nursing rounds this morning, and you heard about a topic.
That's right. At a meeting this morning, Charles O'Donnell talked about suicide prevention and self-awareness. And, it was just an excellent, it was about 15 minutes, just an excellent presentation. It really got me thinking about this issue. We've been existing in the last 4 months in a very stressful environment. Social distancing can mean social isolation, even though we don't want it to be. It can mean that. And that starts people down bad paths, or can start people down bad paths. And in a circumstance like this, suicide can become more prevalent.
Yes.
And you understand that. You even, unfortunately, in your practice, see the result of that. So we wanted to say something about this today. I think we're going to ask Charles maybe to talk at some other venues, to some other groups, because I think it was just such a good talk. But I think 2 points to make about this. If you're feeling bad, and that's maybe not a good clinical word, but if you're feeling bad, don't be ashamed to ask for help.
Yes.
And the flip of that is, if you're noticing that a colleague or a friend or a loved one is struggling in that same way, reach out to them.
Yes. We've talked a lot about the Albany Medical Center workforce being a family. And what we're saying is that these are definitely trying times, and we want us all to be looking out for each other. So it's a great message.
It's your message at the end of every video.
It is indeed. And this is a topic that I think some people might be uncomfortable talking about, but it's really important, and I'm certainly glad you brought it up. So thank you, Fred. Lastly, we want to talk about a book. Let me give this to you, Fred. So who is Willie Dean? Willie Dean is a member of our security team here. He's a new member of our security forces. And Willie's a really interesting guy. I've met him. He was actually a very well-known basketball player from Schenectady. You're from Schenectady.
Yes, I am.
I think he was probably a better basketball player than you, because he played at Purdue, and he went on to play internationally. And Willie now also writes children's books, and he wrote a book called Love, which is a really good message, especially today, and we wanted to share his book. I think we're going to highlight him in an upcoming AMC article, whether it be the page or something on our internet, to focus on his great work, but we wanted to share it. And it's called Love, and it's a really good book. So we wanted to congratulate Willie, and we wanted to thank him for sharing that with us, and we hope other people will also read it.
So Dennis, we don't have enough time. I know you'd love for me to read a passage with my soothing baritone, so we'll have to take that offline.
Well, you would certainly do a good job. I think there's many people out there that would want you to.
There are a couple, I think, who would probably ask for that.
We might actually do a special segment. Anyway, great book, Love by Willie, and we thank him for sharing that with us.
Thank you, Willie.
All right, very good. So Tuesday, Thursday is our cadence.
Yes.
So we'll be back again next week. I'm going to guess our numbers are still going to keep going down.
I think
which
so,
would be
Dennis.
Great if everyone out there continues to do the right thing.
That's right.
Very good.
Wear those masks.
All right, very good. All right, we'll be back next week. As always, we ask that you please take care of yourself, take care of each other, and we'll see you next week.